This video will show you how to administer IV medications via a syringe pump. Your medical team will instruct you how often your child's medication needs to be given and when. You will also be instructed when to change the IV tubing. First, you will wash your hands with soap and water as instructed in our hand hygiene video. Next, you will prepare your clean workspace as instructed in our Preparing a Clean Workspace video. Next, you will set all the supplies you need on your clean workspace. For this, you will need the syringe pump, an IV tubing set, the medication syringe, 3 alcohol wipes, a light blue dual cap, a dark blue dual cap, 2 saline syringes, 1 heparin syringe, and a pair of clean gloves. Next, you will wash your hands again with soap and water. Then you can put on your clean gloves. Next, you will prepare your saline and heparin flushes as instructed in our Preparing Flushes video. You will also need to prepare the medication syringe. First, uncap the medication syringe and push out the excess air. Recap the syringe without contaminating the tip of the syringe or inside of the cap. Next, open your IV medication tubing package. Attach the medication syringe to the IV medication tubing. Make sure not to touch the tips of the medication tubing or the medication syringe. Once connected, you will prime the tubing. Push on the plunger gently until you see a drop of medication at the edge of the tubing. Then you will clamp the medication tubing and attach the medication syringe to the syringe pump. Make sure to fit the wings of the medication syringe into the grooves as shown. Then you will pull down on this piece to connect the circular end of the medication syringe into the pump. The pump will be programmed already for you. You will just need to turn the pump on. Now you will go to your child and remove the light blue dual cap from the microclave. Then you will take an alcohol wipe and scrub the blue microclave with an alcohol wipe for 15 seconds. Make sure to scrub the sides and the top of the blue microclave. After you have scrubbed for 15 seconds, let air dry for 15 seconds or longer until completely dry. You will then take your first saline syringe and push in and turn to attach. If you touch the tip of the syringe to any other part other than the child's blue microclave, you will need to grab a new syringe and start that part over. Then you will unclamp the lumen and push in 5 milliliters of saline using a push-pause method. Clamp the lumen while you are flushing in the last of the saline. Now you are ready to attach the medication tubing to the blue microclave. Remove the protective cap from the medication tubing and push in and turn to attach to the blue microclave. It is very important before this step to ensure that you have primed the tubing. Next, unclamp the lumen. You can then press start or on your pump. When the infusion is complete, the syringe pump will alarm and you can stop the pump. Wash your hands with soap and water and put on a new pair of clean gloves. Then clamp your child's lumen and the IV medication tubing. Scrub the connection between the IV medication tubing and the blue microclave with an alcohol wipe for 15 seconds. Once you are done scrubbing for 15 seconds, let air dry for 15 seconds and until completely dry. Once dry, disconnect the IV medication tubing from the blue microclave and place a dark blue dual cap on the end of the IV medication tubing. This will help protect the IV medication tubing so it can be reused for doses within a 24-hour time period. Then scrub the blue microclave with a new alcohol wipe for 15 seconds. Once 15 seconds has passed, let air dry for 15 seconds and until completely dry. Once dry, take your saline syringe and push in and turn to attach the saline syringe. Unclamp the lumen and give 5 milliliters of saline using a push-pause method. Clamp the lumen while pushing in the last of the saline. Then push in and turn to attach the heparin syringe. Unclamp the lumen and give the prescribed amount of heparin using a push-pause method. Clamp the lumen while flushing in the last of the heparin. Then place a new light blue dual cap on the end of the blue microclave. If you are reusing the IV tubing for another dose within a 24-hour time period, you can remove the syringe from the pump and leave the empty medication syringe attached to the IV tubing. Place this in the bag provided and place into your refrigerator until the next dose. Otherwise, you can discard your empty medication syringe and IV tubing. If you are reusing IV medication tubing for doses within a 24-hour time frame, follow these steps. First, wash your hands with soap and water. Prepare your clean workspace and set the following supplies on your clean workspace: your syringe pump, IV tubing with your old medication syringe from the refrigerator, the new medication syringe for the next dose, 3 alcohol wipes, a light blue dual cap, a dark blue dual cap, 2 saline syringes, 1 heparin syringe, and a pair of clean gloves. You will wash your hands again with soap and water and put on the clean gloves. Then you will prepare your saline, heparin, and medication syringes as instructed earlier in the video. Now you will scrub the connection between the IV medication tubing and the used or empty medication syringe with an alcohol wipe for 15 seconds. Once 15 seconds has passed, let air dry for 15 seconds and until completely dry. Once it is dry, you can remove the empty medication syringe and attach the new medication syringe to the IV medication tubing. Then you will attach the medication syringe to the syringe pump as instructed earlier. Now you will go to your child and remove the light blue dual cap from the microclave. Scrub the blue microclave with an alcohol wipe for 15 seconds. Once 15 seconds has passed, let air dry for 15 seconds and until completely dry. You will then take your saline syringe and push in and turn to attach. Unclamp the lumen and give 5 milliliters of saline using the push-pause method. Clamp the lumen while flushing in the last of the saline. Now remove the dark blue dual cap from the end of the medication tubing. Push in and turn to attach the medication tubing to the blue microclave. Unclamp your child's lumen and the medication tubing and turn the pump on. It is very important, if you feel you have touched the blue microclave at any time, to use a new alcohol wipe and scrub for 15 seconds before proceeding.